Because erectile dysfunction is a problem many wish to avoid. New research suggests an unlikely symptom that can give men a heads up about future problems down there. Pain in your big toe. You heard that right. A big red toe may be a big red flag for your penis. I'm talking about gout. Interestingly enough, a study followed 48,000 men for an average of 10 years and discovered that within 2 years of a gout diagnosis, the risk of erectile dysfunction was 77% higher. Wow. And the reason I said related to alcohol is in medical school, we learned gout is the king's disease. People who had
eating rich foods
and out drinking a lot of beer and
carrying on.
Because of the uric acid.
Yes.
The purines in food can lead to uric acid buildup.
What surprised me is that gout affects the musculoskeletal system, your joints, your tendons, and literally you can have these gouty deposits all over your body.
So it's not just your big toe.
Right, but I was a little surprised that I think of ED more as a vascular issue, a blood flow type thing related to, blockage of your...
But maybe the excess uric acid in some way, shape, or form is having an inflammatory effect.
Yeah.
These things do go hand in hand, though. Rich foods, you're more likely to have gout, you're more likely to be obese. So look, this is kind of one of those, did they tease everything out here? Because, again, the image is of an old king sitting in their throne, portly belly, drinking their wine, eating all their rich foods.
Looking down and go, boy, why aren't you working for me?
Yeah.
Well,
you're in trouble when the biggest appendage on your body is your big toe. When that's the only thing that's getting
for men, though, that we talk about this, that your ability to get an erection is a barometer of your overall health.
So what can you do to prevent this? Because our partners will thank you, right, for teaching us this, because we don't want our partners
staying at a healthy body weight.
Okay.
Staying hydrated, limiting some of these rich foods, fatty foods, sardines, beer, these things that have...
Especially if you know you have a genetic history, very often you will have somebody in the family who's had it. You need to be more vigilant, and I think diet and exercise.
But some people, just for whatever reason, during the metabolic pathways, they can just develop these uric acid crystal buildup. But incidentally, this is a really important takeaway. I learned this very early in the emergency department. When someone comes into the ER with a big, swollen, red big toe, I cannot look at that and say, unequivocally, that's gout versus septic arthritis versus some other condition. So if out of the blue we've been talking about this big red toe, trauma, if you have that and it occurs and this is the first time you don't know what's going on, that could be a medical emergency.
Yeah, more than 2 million Americans do have gout, and it occurs more frequently in men than in women. And in guys, it will often occur between 30 and 50. For women, a lot of times it'll happen after menopause.
Important takeaway. And